tonight. And Carl Dalal, I've asked to come and give the perspective of the guy who's in charge of healthcare at Ford. So Carl, you got a word to say to the White House?
Thank you. Governor Granholm, Governor Gillard, Melody. Thank you for hosting it, the first conference in Dearborn, home of Ford. Let me give you a little perspective. Your question on it costs over $1,000 for every car, and that is by and far one of the largest components that we're putting into the cost of the vehicles. So it's not just vehicles, but it's every manufacturer, every company out there. The cost is baked into the product. And what's been happening over the last few years is healthcare costs have been going up. More and more companies are shifting the cost over to the employees, and we're seeing that cost share for employees increasing, and it's becoming a bigger burden. Companies have to do this because it's the competitive thing that they have to compete in the global marketplace. But as the cost shifts, retirees, employees just can't afford the product. And so any healthcare solution really has to address the cost. And at Ford, we have lots of ideas on cost. I know we'd be here till midnight if we give you all the ideas, but let me focus on a couple of big items which we think really can help address the cost. First, as a country, we really need to focus on prevention.
Yeah.
If you look at our Ford costs, we're spending over half our healthcare costs in preventable conditions. So things like diabetes, things like smoking and the effects of people smoking. And we really need to, both as companies and as government, work together to come up with solutions to focus on wellness. We're doing a lot of things at Ford to encourage people to do healthy behaviors, but really we need to get employees, customers engaged in their health so they're doing the right thing and doing the right behavior. So that's one very important thing that we all can do. Second major area I think we need to invest in is in infrastructure and technology. I think I've heard the phrase wire healthcare. If you think about it, when I go to the healthcare, when the doctor, I'm filling out the same forms and the paper forms that I did 20, 30 years ago when I went to see the doctor. Nothing has changed in the healthcare world from technology. And in order to, you see what's changed in the banking area, in the telecom, in terms of retail, they've really advanced technology, and we need to do the same thing. If you look at the doctor's filing cabinets, it's filled with paper forms, and really that adds to the cost of healthcare. So the more we can do to move forward in technology, I think there's long-term dividends that we can get. At Ford, we initiated this project called e-prescribing, which really gets scripts from paper to electronics. We've written more than 4 million electronic scripts in Michigan alone, and we're now the fifth in the nation in terms of electronic scripts prescribed. And we actually save over $4 for every script that's written electronically versus on paper. It's great for the customer, it's great from a company standpoint. The initiatives that you've initiated in terms of from the state for looking at the health information technology, getting data from paper to an electronic, I think is a great step and really sets Michigan to be a leader in that electronic data technology. And the third area that I want to focus on is looking at, and this is a little bit controversial, but really we need to look at proven technology and spend the healthcare costs on those proven technologies. We have a tendency as a country to go look at whatever the latest and greatest drug is, and let's go put the money on there. Let's go look at the latest and greatest equipment and technology or procedure and invest and go chase that. And sometimes the most expensive is not always the most effective improvement. So to the extent that we can use guidelines and research to say this procedure, this practice, this new drug really is more effective than the existing procedures, I think can help save us money long term.
Great.
All right.
All right. So computerization of healthcare records, investment in prevention, focus on prevention, and making sure that we have best practices regarding whether it's prescription drugs or the provision of healthcare practices. Those are the three things that you mentioned. That's from Ford's perspective.